Hi, I'm Dr. Robert LaPrade from the STEMIC Clinic in Vail, Colorado. And what I'd like to do is to run through some MRI scans and review what we look at as clinicians when we're looking at an MRI. There are many different things that we can use an MRI for to diagnose a problem, from meniscal tears to ligament injuries to cartilage problems. We can also see subtle fractures, stress fractures, and bone bruises. So what I'll try to do is go through some individual MRIs to show what anatomy we're looking for, and one's knowledge of anatomy is a key to interpretation of MRIs. So this is on the left knee, and we'll start off with a coronal scan. So a coronal scan goes through the knee from front to back, with the dimensions being medial to lateral in the knee. So when we first start out looking at a coronal scan, we can see the kneecap or the patella, and it's located at the central location. As we go deeper, you can start to see the quadriceps tendon and the patellar tendon below it. And then as we go even deeper, we'll start to get into the tibial femoral joint. On the MRI scan, we'll start to see initially the menisci come into view. So here's the medial meniscus in its front aspect and the lateral meniscus. And then we'll start to see the iliotibial band on the side. As we go deeper, we'll start to see the superficial medial collateral ligament on the medial aspect of the knee, coursing along the tibia. And as we go further back, we'll start to blend back more into the posterior oblique ligament and get to see the menisci and their triangular shape. We can also see the anterior cruciate ligament. Here is the anteromedial bundle of the ACL, and here is the posterolateral bundle of the ACL. The PCL is just starting to come into view. On the lateral side of the knee, we can start to see the fibulocollateral ligament, and here is the popliteus tendon. As we go deeper, we'll start to see more of the PCL, and you can see the meniscal attachments. So this is the medial meniscal root attachment, and this is the lateral meniscal root attachment. Here we can see the inferior lateral genicular artery. Now as we get more to the posterior aspect of the knee, we can start to see the biceps femoris. So this is a common biceps femoris tendon. This is more of the anterior arm attachment, and here's the direct attachment of the short biceps there. And you can start to see we're getting more posterior in the knee, and here will be the popliteal artery. So we're basically in the back of the knee and getting to the posterior structures. Here's the popliteus muscle along here, and you can see as we course forward the popliteus tendon at the musculotendinous junction, and then coursing more anterior. As we get more to the back of the knee, we'll start to see more of the gastrocnemius muscles. And that's basically the main structures that we'll look for in the coronal MRIs. Clinically, most of the time we're looking for meniscal tears either in the medial meniscus or the lateral meniscus here. The next image that we'll commonly use is the sagittal views. Now the sagittal views look at it from front to back. So this is on the far outside of the knee or lateral aspect, and this is the fibular head, and the biceps femoris attachment on the fibular head. Here's the inferior lateral genicular artery as we course more lateral, and then we'll start to see the lateral meniscus. More anterior to the lateral meniscus is the superficial layer of the iliotibial band here, and then we'll start to see more of the cartilage surfaces as we get deeper within the joint. This is the lateral gastrocnemius tendon on the outside of the knee, and we're starting to see more of it along this part right here. Now we can see the more cup-like area of the meniscus attachment with the posterior horn of the lateral meniscus and the anterior horn of the lateral meniscus. We're getting close to the center of the knee here, but one can see the articular cartilage, which is this gray area on the lateral femoral condyle, and then we start to see the articular cartilage of the lateral aspect of the trochlear groove. Now the patellar tendon has come more into view, and we're starting to see the patella as we get more central in the joint. We can see the articular cartilage of the patella here. We can start to see the central aspect of the patellar tendon, and also we can see the quadriceps tendon more anteriorly. As we course more toward the center, we can start to see the anterior cruciate ligament. So this would be the anteromedial bundle of the anterior cruciate ligament. This would be more of the posterolateral bundle. And as you course over, you can start to see the anterior intermeniscal ligament that courses between the two anterior horns of the menisci. The posterior cruciate ligament is just starting to come into view here, where it attaches in the femur and courses down to the tibia, which you can see over on this location. It attaches right along the facet here and right along this drop off of the posterior aspect of the tibia, which we call the champagne glass drop off. Now we can get more into the medial compartment. Here's the posterior horn of the medial meniscus located along here, and then the anterior horn, and we can start to see the more medial aspect of the patella. As we course more, we can start to see more of the posterior horn of the medial meniscus, and we're getting into the far medial aspect where we'll start to see some thickening of the posterior capsule. Now we're starting to see the hamstring tendons come into view here, and this will be the semimembranosus attaching along here, and then we'd have the sartorius, gracilis, and semitendinosus more posterior, and we can use this to determine the size of the hamstring attachments. And then finally, as we get far over, we'll start to see the adductor magnus tendon at the far confines of the vastus medialis obliquus, and then we're getting out to the medial aspect of the knee. The final view that we use is the axial view. That's like cutting through a log, where you see the top part up here is going to be the anterior aspect of the knee, and then the posterior aspect of the knee down here. And this is in the tibia, so the tibial tubercle is here. Here's the fibula, and you can see the neurovascular bundle along here. As we go more anterior, we'll start to get closer to the joint. You can see the patellar tendon start to separate away from its attachment side, and you can see the proximal tib-fib joint start to form here. This will be the popliteus muscle along here, and you can see how close the popliteal artery is posterior to it. The posterior superior proximal tib-fib joint ligament is right here, and as we start to course more, we'll have the anterior ligaments for the proximal tibial fibular joint at this location. As we start to get close to the joint, we'll see the outlines of the menisci, and we look for little ghosting signs along the edge here to see if there's a small radial tear that the sagittal and coronal films may not have picked up. And you can see also the same thing on the lateral meniscus, which is more of a C-shaped, where it comes down and attaches anteriorly, and then we can see the course of the anterior intermeniscal ligament along this location. Here you can see what are called the shiny white fibers of the posterior horn of the medial meniscus, and then the medial meniscal root attachment would be here. We'll start to get more into the femur, and we can see some of the confines of the cruciates, with the posterior cruciate ligament located on the more medial aspect and the ACL more laterally. As we start to get further along, you'll start to see the articular cartilage in the posterior aspect of the femoral condyles, and now we'll start to see more of the trochlear groove up in here, and also the articular cartilage of the patella. So the articular cartilage of the patella is going to be along here. And then we'll start to get into the suprapatellar pouch, which will be above the trochlear groove, and we'll see more of the articular cartilage on the patella. Finally, the things that we look for more proximal to the patella would be the quadriceps tendon, and we can see if there's any degeneration or if it looks like a normal tendon like we see here, where the normal dark outline, and we can see the outline of the vastus medialis muscle as we get more proximal along the joint.